One of the golden standards to actually confirm if there's a intestinal obstruction, it could be large intestine or small intestine, is actually to do what imaging procedures like X-rays, CT scans, MRI scans, and all those scans, right? So, what are the findings? If you do an X-ray and there's an intestinal obstruction, how can you be able to know that okay, this intestinal obstruction actually exists? Yeah, all right. So, radiological findings in both large and small intestine obstruction. All right. So you can see this. You see this type now. I see that the image here actually looks so dark, right? That's an indication that there's an obstruction there, all right? So let's move. We'll talk about the characteristics of how the image will look like. Okay. So radiological findings in both large and small intestine obstruction include there'll be dilatation. That place kind of like loose. Okay. There'll be dilatation. That's enlargement of the intestine above obstruction. Okay. The intestine above the obstruction will be what? Enlarged. Right? The fluid levels, there are multiple S interfaces in the intestine indicates bowel obstruction. There will be gas in the intestine. So presence of gas in the small and large intestine may be abnormal. Then bowel wall thickening. Increased thickening of the intestinal wall indicates what? Inflammation or injury. Stricture. Narrowing of the intestine, and this is due to what? It could be tumor, it could be scar tissue, or it could be inflammation. Then obstruction. There will be complete or partial blockage of the intestine, which is visible on imaging studies. You will clearly see here that there's an obstruction, right? It's so visible. Then intestinal perforation, you might see holes in the intestine leading to free air in the abdominal cavity. Abscess and collection, this is basically what accumulation of fluid or pus in the intestine or the surrounding tissues. The intestinal ischemia, this is basically reduced blood flow to the intestine, and this is leading to what? Damage or death of intestinal tissues. All right. Then specific radiological findings may vary depending on the location and type of obstruction. So if it is large intestinal obstruction now, you might see colon dilatation. You might see feces or stools in the colon. You might see rectal distension. You might see what? Sigmoid colon volvulus, that's twisting of the sigmoid colon. For the small intestine obstruction now, you might see what? Small bowel dilatation, fluid-filled small bowel loops, step ladder appearance. That's a small bowel obstruction. Sorry. Okay, this one is a dilated bowel, right? But it's like a step, right? Step, step, step. Okay. Then you might see strings of Pearl sign that small bowel obstruction with multiple filled loops. Okay. So imaging studies used to diagnose small bowel obstruction include X-rays, computed tomography, magnetic resonance imaging, ultrasound, and contrast studies. All right. That's it about radiological findings in both small intestine and large intestine obstruction, or you could say bowel obstruction. So that's it. Bye for now.